Can we understand from you what conversational AI really is and what it is actually not?
What is conversational AI is basically explaining what is not conversational AI. A lot of that comes from my own personal experience working in healthcare industry for 2 decades. I always say that healthcare is personal and healthcare moments can be emotional. One key thing in any AI systems that we often don't talk about.
Do you feel that is the right metric to track when it comes to conversational AI?
One of the mistakes healthcare companies make is trying to automate everything.
Hi everyone, welcome to today's discussion. In today's world where the AI has reached capability where almost 9 out of 10 people are not able to identify whether the voice is that of a real human or an AI, in the same environment as AI is getting deployed in the production environment, people are getting more and more frustrated and they are increasingly asking for human intervention when it comes to contact center. This is kind of an AI trust paradox that is happening in the world today. And to discuss that and do a deep dive further, I today have Anup Kamath here with me, and we are going to deep dive into what is going on behind the curtains. So welcome Anup to our discussion today.
Hi Abhishek, nice to meet you.
Sure Anup. To start with the discussion, Anup, I wanted to, really start from the point where, we are talking about conversational AI. There is already a lot of buzzword around agentic AI. Can we understand from you what conversational AI really is and what it is actually not? People are also, kind of labeling and wrapping, these chatbots as conversational AI. So we wanted to better understand how do you see conversational AI and what it really means.
I think the best way to explain what is conversational AI is basically explaining what is not conversational AI. I always start with it is not a chatbot, it is not an IVR, it is not a system which takes commands and just executes the script. That is not what conversational AI is about. In my definition, conversational AI, basically it needs to understand intent, maintain context, have the ability to reason through ambiguity, and help people accomplish those goals. Now, specifically where I come from in healthcare, it matters even more because people don't make a call asking structured questions. Half of the times they are either frustrated, they're anxious, and most of the times they don't even know what they need. That's where conversational AI becomes more of an interaction layer between the consumers and the systems. Whether it is pharmacies, whether it is provider, whether it is care access, whether it is apps, digital services, I think the conversational AI makes conversation the first interaction point. That's where conversational AI makes a big difference. Now, in your introduction, I heard you about the trust paradox.
Yeah.
That's a true statement. What we have seen over the years is while the technology has improved dramatically, the trust hasn't increased naturally in these technologies. I think the one way how I see about conversational AI bridging that trust gap, it's not about just answering for the questions the customers are asking to you. I think it is also to know how to make those answers more trustworthy, more reliable, and more importantly, when to involve the human to answer those questions. So I think if we design our systems with that mindset, I think the trust paradox that you just started with, that gap will basically be addressed through that mindset. Conversational AI should definitely know about when to bring in the human for the relevant questions where humans feel more confident interacting with humans than the systems.
Excellent, right? So I think a lot of things you said in the response that I feel it's worth, highlighting. I think nowhere I heard about leveraging, the advanced technology or the foundation models. You are focusing more on the empathy, ability to connect with the humans, the journey part of it, how the humans are getting handled by the AI. I think a lot of the other dimensions that are currently in today's environment not actually being considered, which are actually very important and critical from your perspective. So I think that's very relevant and a very important aspect to consider when it comes to conversational AI, and of course, how we can actually improve the trust deficit that is currently in the market.
Absolutely. I always say that a lot of that comes from my own personal experience working in healthcare industry for 2 decades. I always say that healthcare is personal and healthcare moments can be emotional.
Yeah.
So if you don't bring in that empathy in the right conversations, you will never be able to build and establish that trust with your customers.
Perfect.
So I think that conversational AI is about how do you leverage technology, how do you leverage conversation with right empathy to meet that patient needs.
Thank you, Anu, for that, sharing your insights about conversational AI. I now wanted to go more towards understanding the whole architectural aspects of building these conversational AI solutions, right? It's one thing when you deploy these systems in a demo environment under controlled conditions and the environmental factors, but when it comes to really building these systems for production environment, right, it's a completely different ball game. We are talking here about hundreds of millions of calls that have to be handled. One of the critical element or the non-functional requirement that we often talk about, the latency, is no more an architectural concern, it's an experience that really matters. How do we think about building these systems for production, which are multi-cloud spanning, involving all the different aspects to be able to deliver the same experience to all the customers across the network?
I would like to start with at scale. Latency is not just a technical metric. It becomes a human experience metric as well. What I mean by that, when you are having a conversation with someone and when there is an awkward pause, the conversation starts feeling very unnatural. And that's where I always say this, that every millisecond when you are interacting matters. Since you asked question about how do you address latency in conversational AI deployments, I think about it in multiple layers.
Sure.
Number one is the separation of duties. We leverage distributed microservices architecture to scale capabilities independently. Now, what I mean by that, capabilities like speech recognition, authentication, knowledge retrieval, fulfillment, workflow orchestration, all of these things can scale independently. Second, we talk about streaming architecture. We don't wait for one system to complete their task to start the another task by another system. So we stream everything. Third technique we often use, what we call it as speculative retrieval. What it means here is when a patient is talking about their medications, we are predicting their likely intents.
Interesting.
And we are retrieving that knowledge so that we can answer those questions when patient really needs those answers. But that's what I mean by speculative knowledge retrieval. Fourth, we also think about how do we not just optimize for speed, we also have to optimize for resiliency. Now, what I mean by that, see, when specifically in healthcare, the conversations that happen can happen with emotional tone. It can happen in noisy environments. So when you're having on addressing those conversations, you just can't optimize for speed. You
Sure.
also have to optimize for resiliency.
Interesting.
And that's where the resiliency becomes as important as speed. Now, what I've been reading here is the industry has been exploring speech to speech architectures that will improve latency at scale. However, in highly regulated industries like healthcare, I feel the cascade architecture still has its own advantages, specifically around observability, compliance, control, and explainability. I still feel like cascade architectures have advantages in highly regulated industries like healthcare. In short, what I would like to say that here is when you are deploying systems for scale, you just can't focus on latency as a technical metric. How do you improve your latency to make your conversations make more meaningful? You also have to solve for continuity, trust, and more importantly, reliability of those conversations.
I just wanted to build on the response that you gave, and especially the last part of it where you spoke about the observability part of it, right? You cannot actually improve anything that you cannot measure. Running these kind of systems in production with hundreds of millions of calls, how do you ensure the quality of these agents is as per the standards or the benchmarks that you have set? And then how do you evaluate these agents that are running at such a high volume?
It's a good question. I think when I mean observability, it does not start with just learning or evaluating a couple dozens of calls and trying to conclude whether it's working or not, right? I often, harnessing on my experience, what I've seen here is when you talk about conversational AI observability, there are a couple of layers that goes into it.
Sure.
One is focusing on some key KPIs, like are we solving the customer needs? Are we getting customers what they want and when they want? That's the number one metric for me. It's not about call deflection. It is not about call avoidance. I think the best conversation here is, which is how to avoid the conversation. It is about how do we make the conversation feel complete for the customers who are making those calls to our contact centers and pharmacies regarding their medications. Second, I lean a lot on evaluating and reviewing where the conversations break down, looking at those failure patterns. And I think that's where the learning happens. And it helps us improve our responses. It helps us ground our responses, and it helps us iterate our conversational interfaces so that we know we are able to answer all the different types of questions our customer has when they're interacting with conversational AI systems.
That's a fantastic response, Anup. Thank you for that. Coming, back to that architectural discussion that we have been having, right? The other angle that I wanted to explore with you, healthcare is a highly regulated industry. And in this kind of an industry where, you are deploying these frontier AI models, there are two-part challenges that come with that. First is when you're deploying these AI models for building out these kind of solutions, one of the highest risk is leakage of the patient data. Many a times, and we have often heard, these data is being utilized for training of the frontier AI models, or for the custom development of the other models. How do we ensure that this patient PII and PHI specific data does not get leaked into the external environments? And the second part of the question is more about the whole hallucination aspect of it, right? Foundation models are also very notorious about fabricating the facts. How do we make sure that the responses conversational AI systems are giving, specifically in the healthcare context, are grounded into the facts and do not hallucinate when responding to the patients?
Well, I would say that the answer somewhere lies in your how you framed your question. But before I start there, let me tell you, specifically spending 2 decades in healthcare industry, you're absolutely right. Data, trust, and PHI handling is non-negotiable to us.
Sure.
Anything related to a patient's healthcare information, we take a pride in maintaining that sensitivity of that data. So whether it is any AI system deployment or any traditional system deployment, we always have to start with how do we guard the data and how do we manage that data so that the data is put into right use and not into misuse. Now, having said that, specifically to answer your question, I kind of break that into 2 problems. One is how do you avoid leakage? And when I talk about leakage, is maintaining those PHI isolation boundaries. We are very sensitive about what data enters into the models and what data should stay where it should really stay. That's number one. And there are a couple of techniques we use for that, things like redaction pipelines, scoped retrieval. We basically use controlled retrieval architecture patterns to ensure what data goes into the model is really meant for a specific use case. And just because you can send every data to the model, we don't send every data to the model. Second thing, I also call it as fabrication. We focus a lot about fabrication. Now, what fabrication really means? How do you prevent AI from inventing facts which can potentially create or impact patient clinical care?
Sure.
So the techniques that we use here is, one, we just don't rely on the memories model for all the responses. We ground those responses against our enterprise knowledge repository and verify that against trusted healthcare information before we present those responses to the customer. So that is absolutely important when we talk about deploying any AI systems in healthcare. What I specifically learned, specifically in AI, model itself is not the most important part of the architecture. The guardrails that you build within your architecture are the most important aspect of how do you build conversational AI systems or any AI systems for that matter to serve healthcare needs.
Fantastic, right? So many things that you've spoken about, be it the redaction pipelines, be it the controlled retrieval architecture. That's a pretty new term for me that I'm hearing today, but absolutely something that I would like to learn more about. And then you also spoke about, the whole fabrication part of it, how you are managing that at scale. Just thinking through that, right? Putting so many guardrails that you spoke about, the fabrication aspect mechanism that you spoke about, the redaction pipelines that you spoke about, all this actually adds up to the latency of your solutions. And just the earlier discussion that we were having was about how do you manage the latency? How do you manage the balance between the latency versus all these critical parts of your pipeline?
I think the one key thing in any AI systems that we often don't talk about, or we probably don't talk as much as we should, is the role of memory management in any healthcare system or any AI system, I mean to say. And people, that's a general misconception. Okay, memory management is all about making healthcare experience feel more intelligent, which is definitely true. But I will also say that memory management technique also solves for latency.
Sure.
It is not just an experience. I mean, end of the day, it is all about how do you enrich the experience in the conversations that you are having with the humans. And the role of memory management is a critical aspect of any healthcare or any AI system deployment in any industry. Specifically, when I talk about memory management, I think about it in multiple layers. Number one, session memory. The session memory is basically knowing what is happening in the current conversation, remembering what is the conversation about. Then I talk about things like what we call it as the workflow memory. The workflow memory is, in an example, if you're doing a prescription transfer, it can have multiple things. You are interacting with inventory agents, you are interacting with your benefits agent, you're interacting with your patient communication tools. There are multiple agents that are in play to make your experience feel complete. While session memory helps you track what is happening in that conversation, the workflow memory helps you remember patient is here for the prescription transfer goal, that whole process. Then we talk about longitudinal memory. The longitudinal memory is, it basically surfaces patient's historical context. What are the patient's preferences? That is important in how you frame your responses. And last, we also talk about leveraging enterprise knowledge repository and trusted healthcare sources to ground your responses, which we have spoken about it earlier as well. Now, all of that is not just solving for a latency problem or not just solving for continuity problem. All of these things come together to make the experience feel complete and to make conversation feel more natural.
Got it. So it feels like, I think you're going back again to the point that you actually mentioned in the very first discussion. It's the experience, right, that matters. And then I think the way you describe the whole session management part of it, or the workflow memory management part of it, or the longitudinal memory management part of it, it feels like, balancing the latency with the experience is the kind of fine balance that you have to tread, and making sure that you are providing a better experience, a very connected experience, has got a more preference as compared to the latency. Yes, latency is solving for the latency is very important, but then providing a more holistic and a complete experience is really the higher priority when solving for these systems in production.
See, that's true, right? I mean, think about it this way. We spoke about the 4 layers of memory,
Sure.
which will make the AI feel more intelligent. But somewhere between those responses, you could also see that it also solves for latency, because
Sure.
in the absence of memory, what would any traditional system or any system would do here is they will make multiple backend calls to retrieve the information.
Sure.
Now, with these multiple layers of memory management techniques in AI deployment architectures, what you could do here is not just making your AI system more intelligent, but also avoiding those unnecessary calls. And using techniques like what data should be cached and for how long and where it should reside will all make that experience feel more balanced and more natural. Now, one thing I want to also caution about, the big challenge in any healthcare deployment here is how do you maintain the balance between memory management and privacy, which is very important, right? Just because you can remember something, that does not mean you have to remember everything. So that's where the balance, that is where you have to really strike the fine balance. And we are very intentional about when we build these AI systems and when we talk about leveraging memory to make the experiences more natural and more complete. We are very intentional about what data
goes to the memory,
what data goes into the model, as well as what data we cache, how long we cache, and where it is kept, so that it is not compromised for. And basically, you have to be very careful about ensuring that data is put into the right use, and you're not using data to make the experience complete, but compromising on the safeguards and the governance mechanisms you have in your systems.
Thank you, Anu, for your response. We spoke about, the latency. How do you tackle the security part of it, the HIPAA regulations part of it, and we kind of also dug into the whole memory management part of it, of how do you run these systems right in production at scale without compromising the patient experience. Moving from there, I just wanted to have a conversation with you more around the deflection rate, right? It's an industry-wide metric which many of the people are obsessed about. What are your thoughts about that? Do you feel that is the right metric to track when it comes to conversational AI, specifically from healthcare perspective?
I always say that deflection rate is a vanity trap, vanity metric trap, I mean. So what I mean by that here is deflection rate can create a perception of cost savings. But if the patient needs are not met, specifically in the healthcare industry, or when the customer needs are not met, it basically creates the trust problem. So the metric that I care about, honestly, is whether we have met the patient needs completely, whether we have reduced their anxiety, whether we have helped them get what they called for, and more importantly, whether we have moved their journey forward. I think that's what I care about when I talk about a metric, one metric in deploying conversational AI systems, which is specifically in healthcare industry, you have to meet your patient needs.
No, I think that's great. Just following up on that, right? The other angle for this is really the containment rate. The higher the containment rate is, we have seen that the patient frustration kind of increases as you try to deflect more and more calls, right, from human agents towards conversational AI. How do you manage, this fine balance of handling the calls through conversational AI versus managing the calls through the human agents? What kind of escalation logic do you think about when putting system into production?
Yeah. So one of the mistakes healthcare companies make is trying to automate everything.
Sure.
So the goal should be not to automate everything. It is about understanding what to automate and what not to automate. So let me give an example. A patient calling in to know about their pharmacy hours is going to look a lot more different than patient calling in for their missed refills or medication side effects, or even having anxiety about whether their medication is going to be ready. Now, that's where it's very important for conversational AI systems to understand those signals. We leverage a couple of techniques to do that. We look at the clinical complexity of the question. We look at ambiguity of the question. We look at emotional cues. We look at repeated failures in answering similar type of questions, and we also look at patient vulnerability. I think
Sure.
when we look at all these signals, these are the signals one needs to consider when AI systems need to stop answering those questions and when to bring in the human to answer those questions. And more importantly, when human is brought in to answer those questions, the context needs to travel to the human. Now, the worst experience ever could be if the patient has to repeat everything,
For
then the
sure.
human
Yeah.
comes in. So, to make the conversations feel more complete and more meaningful, the AI systems need to know when to bring in the human with the context shared with the human for human to deliver the right meaningful services or answers for the patient needs. See, one of the mistakes the industries make is focusing too much on detecting frustration. So what I feel here is somebody is already frustrated, they
Yeah.
already lost that trust.
Interesting.
The best AI systems should be able to identify those signals which can lead to frustration and avoid leading the patient or a member to that frustration. So I think capturing those signals and detecting those signals and understanding that context is what makes AI systems much smarter, which is that's when they need to decide when to bring in the human, and human needs to be empowered with the right context so that they can deliver that meaningful conversations for the patient needs. Finally, I say this, you cannot really design your system where AI and human work like two separate agents. The best experience of AI looks like when AI and human work as single coordinated care team, specifically in the healthcare industry. In the end, I would say that the smarter AI systems is not about answering all the questions. It is about knowing when to bring in the human where they can create value for the conversations.
Than just pure science of when a human should be taking care of the calls versus the conversational AI, and then the multi-layer of escalation logic that has to go behind the curtain to really decide who takes care of what. So thank you for that response. So thank you, Anup, for that response. I wanted to now talk about, from the conversational AI perspective, about the adoption of it, right? And when it comes to conversational AI, it's really a hard task, right? While building tech is definitely something, a challenging aspect of it, but driving AI adoption, in my experience, is even more harder, especially from conversational AI perspective, right? Where you have got two set of stakeholders. One is your internal employees who need to learn and adopt these AI tools. And then on the other side are these customers who need to be able to leverage these conversational AI solutions, right? For getting the responses that they're looking for. From your perspective, how should we think about driving AI adoption, specifically from the voice AI perspective?
I think it's a very valid question. In fact, my observation also has been while building technology has its own challenges, the adoption is really hard.
Yeah.
That's the key problem to solve for, whether it is AI system in healthcare, or I'm assuming that's probably same everywhere
Sure.
in other industries as well. I think one of the key wins, based upon my experience, what I've learned here is there are two type of adoption challenges, right? As you rightly said, how do you make your internal workforce adopt the technology? How do you build the trust within your internal workforce in the technology? How is that technology going to augment and scale their expertise? The second is the consumer adoption. How do you build the trust and no consumer is coming to conversational AI systems, and the answers that they're getting from conversational AI systems are more trustworthy, safe, and more reliable? How do you build that trust within your consumer base as well as your internal workforce? I think one of the things what I have learned is get those frontline representation early in the design cycle.
Absolutely.
Give them tools, understand their problems, make solve meaningful problems for them, show them the value of how technology is going to scale their expertise, or how technology is going to help them get their problems solved faster and a much easier way. And it cannot be done, it's not just a one stage process, it needs to done continuously. And more importantly, there should be a listening mechanism, there should be a feedback mechanism. What you learn from those sessions, what you learn from your users, how do you take back and make your conversational AI systems smarter and more responsive for their needs? That's how I feel adoption needs to be looked through. You cannot look at any technology deployment of AI systems purely from cost savings or performance improvement angles. You have to first start with how is it going to help my consumers or my workforce elevate the quality of care that they deliver or they experience when they come to your companies.
Thank you. I think that's a very good way of thinking through. And then just building on what you said, right? Making people learn and use these tools, bringing them early into the process, making them, provide their feedback into the process. I think the other element to this is really the fear, right? And specifically from the contact center perspective, from conversational AI perspective, this is something where there is a lot of fear in the market of job displacement, right? When it comes to conversational AI. How do you think, people should think about leveraging this without the fear of their jobs themselves getting displaced? How do we ensure, that people are able to move up the value chain and be able to deliver more and more meaningful work without the fear of their job loss?
Yes, there's a lot of talks these days, and you read in the news about AI capturing jobs or AI making people lose their jobs.
Yeah.
And people call it as the AI doomsday. I heard all those sentiments in the news, as well as experience some of that in my friend circle as well. What I feel really here is specifically in industries like healthcare. Talk about healthcare. When I lean into my experience, healthcare has a very, very unique problem. You hear about people waiting for months and months to get their primary care appointment. You hear about clinicians are overloaded with administrative tasks, which takes the time away from them to do meaningful clinical tasks. Specifically in pharmacies, you hear about pharmacist is occupied chasing prior authorizations, filling prescriptions, which takes them away from the task like adherence coaching, comprehensive medication management, disease management. So if you think about the narrative really here is the people that we have in these industries are already overloaded.
Sure.
So how do we help them? I think that's where AI can come in and help address the gaps that we see in this industry. I think more importantly, it is important to, as part of your adoption journey, when I spoke about bringing your customers, bringing your internal workforce as part of the design journey, it is also important to let them know this is not about replacing their jobs, it is about scaling their expertise, specifically for internal colleagues. Imagine a pharmacist has more time now to focus on care interventions, focus on disease management, or even helping people with care transitions when somebody is getting discharged from hospital. I think that level of capacity is what AI systems will help them create for them. Now, when you talk about customers, the customers specifically should feel more trust in the solutions that you are deploying for them. And that trust is not easily earned. It is about customers need to consistently feel the responses that they are getting from AI systems are helping them meet their needs in a much faster and an easier way, which allows them to access the human when it really matters.
So it almost feels like, as you're describing this, right, it almost feels like counterintuitive, where in the healthcare industry, where the systems are already so overloaded, leveraging AI to do some of the ground level work, some of the basic automation or delivering the value to the patient, there is still so much of work to be done, higher up the value chain where the pharmacist can actually do some meaningful work. It feels like, people are just kind of mongering upon the news mongering of the loss of jobs. It feels like from the healthcare industry perspective, that's not the narrative that you see.
I think it's pretty common, right? I mean, when you see something bad is happening, people
You start to overlay that.
people start reacting to that
Yeah.
very quickly, right? Of course, what has happened with these job losses is very unfortunate, but I personally don't believe it is because of AI can do things now differently that humans were not capable of. I think the narrative needs to shift from AI replacing jobs to how humans need to leverage AI to make their jobs more meaningful, and how can they create more value in the job that they do. And I am very optimistic about you will see that narrative changing in the coming years when people start realizing how technology is helping them become more productive, or how it is helping them operate at the top of their license, specifically in the healthcare industry. You will see that narrative changing from AI replacing jobs to now I'm able to see more patients, or I'm able to deliver more care, or I'm able to free up myself. I'm able to free up myself now for having those meaningful interactions with my customers.
And just coming this to an end of our discussion today, like the kind of scenario that you described, right, where in the future uh, there will be more and more meaningful work that the people will be able to deliver, more number of patients the doctor will be able to see, more number of prior authorization that can be processed, right? What is it from your perspective, the 2030 view of conversational AI going to be? How do you see the future evolving? And then a second follow up question to that would be, with that kind of a future, what would be your advice for the people who are entering this industry? What kind of skills they should be focused on to be ready as they enter the workforce?
Yeah, that's a very good question. I'm sure, I think there is a lot of things that will happen based upon, I think a lot of things have already happened. And yet, I think the potential of these technologies and how it can help industries like healthcare is enormous, and we'll probably all experience in the next 4 to 5 years to come. I think two things that come to my mind. I think about it from a perspective of care teams. The care teams that we have today in the healthcare ecosystem is going to look very different probably 5 years from now. Today, let's say somebody is seeing 5 patients a day, or somebody is filling 100 prescriptions a day. I think that will change. The narrative will change from I'm seeing 8 patients a day, or I'm filling 100 prescriptions a day, to these are the outcomes I'm delivering for more patients. Or in terms of I'm not just filling prescriptions for my patients, I'm also closing the gaps in care for my patient.
That's a very interesting point.
I think that you will start seeing healthcare companies moving their needle in the value based care delivery model. And you will see the healthcare experience journey for the customers will also go through a lot of changes. Now, what I mean by that here is today, when patients come in or access these technologies, they come to conversational AI systems or even digital apps with a certain need. They ask questions and then they get answers. Now, I don't think that is going to be the end state.
Interesting.
What I see here is in the future, a conversational AI is going to become a operating system to coordinate care across fragmented systems and create those experiences even before patient actually needs it. It is going to be more proactive and more personalized. So even before patient misses the refills or patient has affordability issues, the systems will be able to detect and surface them before even patient comes to ask for them.
Sure.
I think that's where I feel customers will begin to experience that change. And that's where the workforce will feel more confident and more prepared for delivering that care for the patients that you don't see that today because they're already so overwhelmed.
So I think that's a beautiful vision that you have. And then from that vision, what would be your advice, right, for the workforce that is going to enter in next few years? From that kind of a perspective, what kind of skills that they should rather focus on?
I could be wrong in saying this. I will say that don't be over obsessed about learning models. Don't be extremely worried about, hey, how is the model generating the responses? I think, in my perspective, models will continue to evolve. Voice quality is already improving. I think the things which I want to bet on are, how do you make your AI systems more capable to reason and provide responses within the established guardrails? Now, it's not just understanding the technology. It is not just about how do you create the right guardrails within the models to provide the right responses. I think it requires thinking above and beyond that. My message for the people coming into this workforce, they need to stop worrying about learning the models or being overly obsessed about what models do. I think people who are coming into the workforce need to learn about systems thinking, data architecture, building the right guardrails and governance practices in their solution, improving the reliability, and more importantly, knowing more about how do they do AI evaluation and observability. But beyond that, what I feel here is people who are going to really succeed, somebody who can bring technology, human behavior, and business processes all together. And those are the people who are going to really succeed in the ecosystem or the workforce to come. In closing, what I would like to tell people here is, I don't think healthcare needs more technology. The healthcare needs technology that will make it easier, simpler, safer, and more importantly, it will make it feel more human.
Absolutely. No, fantastic. So, as you heard, guys, right? So, it's not only going to be technology and element for you to master, but understanding the holistic aspect of how technology is getting deployed in the environment or in the setting. When it comes to conversational AI, understanding how the customer experience is going to be impacted by use of this AI technology is also an element to understand. So, thank you, Anu, for this conversation. Really great insights. Thank you again.